Hello and welcome. I would like to start by thanking you for considering us for your procedure. The purpose of this video is to inform you about rhinoplasty, also known as nose job or nose surgery. Let's start by understanding what is rhinoplasty. Rhinoplasty is the refinement of the shape of the nose, as well as the improvement of its airway function. Interestingly enough, nose reshaping has a major impact in the way how we are perceived by other people. In fact, the nose is the second most viewed structure of the face after the eyes. Patients who are good candidates for the procedure include people who want to enhance the nose shape, improve their airway, or correct deformities secondary to traumas or headaches. What can we correct with rhinoplasty? Some of the specific complaints are the presence of a hump, wide nasal bones, crooked nose, and a boxy tip. Some contraindications for rhinoplasty include smokers because of the poor healing, and patients with non-controlled diabetes, hypertension, blood thinners, and COPD. Some important history that we need to do in preparation for your surgery are allergies, history of nose fractures, and breathing issues. Now let's review some important considerations in preparation for your surgery. In preparation for your surgery, your health should be as good as it could be. Medically stable, especially if you have hypertension, diabetes, or anemia. When it comes to the labs, I will require that your hemoglobin should be greater than 12. Finally, ideally your weight should be stable or close to ideal. One of the most important topics in preparation for your surgery is to stop smoking. Please do not smoke 4 weeks prior to your surgery and 4 weeks after your surgery. This includes cigarettes, marijuana, and hookah. Also, please stop any blood thinners. This may increase bleeding during your surgery. Smoking has been demonstrated to increase the complications of this procedure. Please do not smoke 1 month prior and 1 month after your surgery. For out-of-town patients, we'll ask them to arrive 2 to 3 days prior to your surgery. They should stay 5 to 7 days after the procedure. Will require a medical clearance. Now let's discuss some events the day of your consultation. We will do a physical examination. We will analyze the proportions, symmetry, profile analysis, and tip definition. First step is to identify the proportions of your face. This will guide me on identifying the ideal proportions that we would like to achieve with your surgery. On the front view, we will analyze the symmetry for your nose. Remember, God did not make you perfect, and that is normal. We will try to improve the balance of your nose to make things that you don't like less noticeable, and with a softer transition. In this specific case, the nasal bones are deviating to the right, and she will benefit from fracturing the bones to realign them. Your profile view will allow us to analyze the dorsum of your nose and the projection of your tip. We will also evaluate the alar width in relation to other structures of your face. Finally, we will determine the proportions of the tip of your nose. Last but not least, we will explore the inside of your nose to determine if we can improve your breathing. At the end, each step of the analysis will become our surgical plan. How is rhinoplasty done? My preferred way of doing rhinoplasty is under general anesthesia. The duration is between 2 to 3 hours depending on the complexity. Revision surgery may take longer. Now let's discuss some rhinoplasty techniques. There are 2 main approaches. The closed one keeps the incisions within the nose. Although it is appealing not having an incision in the outside, an open approach gives a better exposure and control over the structures. Besides, the scar is so small that the trade-off is worth it. This external open approach is my preferred method. Here you can appreciate how the scar will be performed and how it will look 3 months after the surgery. This video represents the open approach for rhinoplasty. The only scar that will be visible is the one at the middle portion of the nose. The arch incisions will be placed within the nose to provide an adequate camouflage. This will allow us to open up the skin and it will give us access to the inner structures of the nose. Based on our discussion, we will modify the inner structure to a nose as shown here. Some of the patients will benefit from narrowing of the ala by doing some resection of tissue. Finally, we will use stair strips to help contour the elevated tissues and 2 splints, one internal and another external, to keep the reshaped bones immobilized. If your surgery is only addressing your septum, the outer splint will not be necessary. Your look immediately after surgery will be something like this, with bruising and swelling. It will get better within the next 7 to 10 days. After surgery, your nose will have the optical illusion of being longer. In reality, I will make it shorter. This is the explanation. The shortest distance between 2 dots is a straight line, as shown here, let's say 4 units. When people look at your nose, they look from the peak of the hump to the tip of the nose, let's say 3 units. In reality, your nose measures 5 units. If we follow the curve that it makes, as shown here. If we give this patient a straight line, it will become shorter, 4 units. However, you will optically see a change from 3 units to 4 units, giving the optical illusion of increased length, which is very clearly shown in this slide. What to expect after rhinoplasty? You should expect a stuffy nose, postnasal drip, cough with bloody tinge, nausea, and vomiting. Bleeding is a normal condition after this surgery. Remember, somebody just opened your nose with a precise tool and in the majority of the cases broke the bones of your nose. This patient has septal surgery. She was concerned about the constant dripping of blood of both nostrils. Notice how the blood is dark in color. Also notice that the flow is slow. If your bleeding is bright red, unescorting, please let us know ASAP. The first 2 to 3 days after your surgery, you will feel that a train rolled over you. I apologize in advance. Usually this is because you cannot breathe the same, and also because you will not be able to sleep comfortably with your head elevated in a chair. Once you're able to have a full night of sleep, you will feel much better. Finally, head elevation and cold compresses will be the best ally to help improve the swelling and bruising. Now let's talk about risks and complications. The purpose of this section is to inform you, not to scare you. The more that you know, the most likely the operation will succeed. I have always believed that knowledge is power to my patients. Let's start by recognizing that the more tissue that we need to remove, the most likely we will run into complications. However, I will be at your side the whole time to have you sailing through any problem we run into. Your allergies will get worse for the first 2 years after your surgery. Asymmetry is the most frequent complication of rhinoplasty. Remember that in the majority of the cases, patients have imperfections and asymmetries as their baseline. I will point out these imbalances with your analysis. I will try to improve on them, but remember that scarring is the variable that we cannot control. Late healing and skin loss is more frequent in smokers or second-hand smokers. Please do not smoke 1 month before and 1 month after your surgery. Also, patients that have had surgery in the past are more likely to develop this complication. Damage to nasal structures is more likely to occur in patients undergoing revision rhinoplasties. If you've had prior surgery in your nose, please provide us with a copy of the operative report. This information is very important in planning your surgery. Bleeding is increased in patients using blood thinners or patients with hypertension that is not under control. Make sure that you are off the prohibited list of medications that we will provide in preparation for your surgery. If significant bleeding is encountered, we will need to pack your nose. If this does not improve the problem, we might need to reoperate. Another complication is redness. This can be due to allergies to the tape. Please disclose if you have any problems with tape in the past. An alternative source of redness is infection. You will be on antibiotics after surgery. If the infection is present, we might need to change the antibiotics to another medication. If this doesn't help, you will need to have some antibiotics through your vein. I have not seen my first one, but you might need to know about it. A common complication is the lack of smell. It is similar to when you had the flu. This is due to the swelling of the mucosas after surgery. Rhinorrhea is the leakage of cerebral fluid through your nose. It is a see-through fluid that does not stop. Most likely to occur when you do a septoplasty. I have not seen this complication in all my years of practice. Septal perforation is more frequent in patients in which we need to remove the cartilage that divides the nose in halves. It usually happens if the mucosa or layer that covers the cartilage is damaged during the exposure of this structure. Once again, this is more frequent in patients that are having revision rhinoplasty. Prolonged swelling is another complication that is a must with this surgery. As I described before, you will have major swelling within the first 3 days. The swelling will decrease progressively in the next 2 weeks to about 80%. The last 20% will take 6 months to a year until it resolves. The final result would take about 1 year after your surgery. Please be patient. Dry eye might be the consequence of swelling of the surrounding structures if you are affected by it. Please let us know. I will prescribe drops and ointments to prevent damage to your eyes. Some long-term complications include scarring, nasal airway obstruction, irregularities, and cysts. Skin numbness will be present especially at the tip of your nose. It will improve over time. It may recur within 6 months to a year. Skin necrosis or death of the skin is secondary to poor blood flow. It can happen in revision rhinoplasty with significant scar tissue. It is definitely more frequent in smokers. Please do not smoke 1 month prior and 1 month after your surgery. Infection happens in less than 1% of the cases of rhinoplasty. You will have antibiotics during surgery and after your surgery. Severe bleeding happens in less than 1% of the population. It is increased in patients using blood thinners or patients with hypertension that is not under control. Make sure that you are off the prohibited list of medications that will provide in preparation for your surgery. Swelling or skin discoloration will be worse the first week. It will progressively be better during the second week. However, the final outcome will be obtained 3 to 6 months after surgery. We can improve it by applying cold compresses during the first 72 hours, followed by warm compresses until the bruising is better. We'll also recommend the use of arnica and bromelain to improve on this topic. In rare cases, there might be damage to the organs, including nerves, blood vessels, muscles, and internal organs. Deep venous thrombosis is the presence of clots in the legs that might travel to your lungs. The day of your consultation, I will be evaluating your risk factors for developing this condition. If your risk is high, we might need to give you a blood thinner to prevent this condition. Independently if you are at high or low risk, walking is your best friend after surgery. Please start walking the same day after your procedure. Finally, unsatisfactory result. Unfortunately, I cannot guarantee an outcome considering that I have no control over all the variables. Here you will find a list of all the complications that we have discussed so far in the presentation. I will do my best to avoid these potential complications. Most importantly, I will be always to your side, trying to correct any potential issues that may happen. Now, let's discuss some events around your surgery. 2 days before your surgery, we'll encourage you to cleanse your skin with an antibacterial soap. The day before your surgery, please do not eat or drink anything after midnight in preparation for your surgery. I will encourage you to take Tylenol 650 mg every 6 hours starting the day before your surgery. At the day of your surgery, at 4 o'clock in the morning, with a small sip of water, you're going to take your usual medications. You will also take Tylenol 650 mg pill. I will ask you to hold your diabetes medication. This is the dressing protocol after your surgery. You'll come out of surgery with an internal and an external splint. On the first week, we'll remove the internal splint and we'll retape and place the external splint again. You'll come for a second and third week where we will be doing some retaping and repositioning of the external splint. We may continue taping from the 4th to 6th weeks, depending on the amount of swelling. Pain-wise, most of the patients have a moderate level of pain. Usually they describe it as a sinus pressure. The score is between 5 to 7 over 10, however, is well controlled with the pain medications by mouth. We'll give you your specific regimen the day of surgery. This is the pain regimen that we'll use. You'll take Tylenol at 9, at 3, at 9, and at 3. You'll take ibuprofen at 6, at 12, at 6, and at 12, and a narcotic oxycodone 5 to 10 mg every 6 hours if the other two pain medications don't hold the pain. After your surgery, you will have nausea secondary to the medications used for your anesthesia. We'll encourage you to eat light food, and you can work your way up as you feel better. You will go home the same day after your surgery. We'll encourage you to walk to prevent clots that can travel to the lungs. This is the follow-up schedule after your surgery. You'll come back to the office 1 week after your surgery. Follow-up in the 2nd and 3rd week for retaping. Regular follow-up at 6 weeks. And regular follow-ups at 6 months and a year. Now let's discuss some frequent asked questions related to this procedure. Those changes after rhinoplasty may happen secondary to the scar tissue formation. The definition may change. The cartilage may warp. Remember, your nose has the memory of the many years of being crooked throughout the whole life. I will use techniques to change this condition. However, the tissues will try to go to their baseline position. The time off work will be between 3 to 7 days. However, the social time off will be longer, up to 2 weeks, so the black and blue can go away. You'll feel 80% by 3 weeks. After your surgery, you're encouraged to walk to try to prevent clots in your legs. Please do not lift heavy. In the first 3 weeks, you need to lift less than 5 pounds. Between 3 to 6 weeks, up to 10 pounds. You might get back to normal after 6 weeks. You can shower 2 days after your surgery. Please keep your dressings dry. When can I drive again? When you are off narcotics. If not, you will be considered DUI. Usually it takes between 1 to 2 weeks, but it varies by procedure. Now, let's review some patients that have undergone this procedure. This patient underwent revision rhinoplasty. She had her first surgery at age 14 to correct a hump. However, as she grew, the cartilage of her nose deformed with the scar tissue. We corrected this condition with her revision. This patient underwent primary rhinoplasty. Her main concerns were the size of her nostrils and the tip of her nose, in addition to her dorsum. We corrected this with her surgery. This patient underwent primary rhinoplasty. Her main concerns were the hump of her dorsum and the width of the tip of her nose. Here you can appreciate her results 1 year after her surgery. The patient underwent primary rhinoplasty. Her main concerns were the hump of her dorsum and the width of the tip of her nose. Here you can appreciate her results 1 year after her surgery. This patient underwent primary rhinoplasty. Her main concerns were the hump of her dorsum and the width of the tip of her nose. Here you can appreciate her result 1 year after her surgery. This patient underwent primary rhinoplasty. His main concerns were the hump of his nose and the width of the tip. Here you can appreciate his results 1 year after his surgery. This patient underwent primary rhinoplasty. Her main concerns were the hump of her dorsum and the width of the tip of her nose. Here you can appreciate the results 1 year after her surgery. This patient underwent primary rhinoplasty. Her main concerns were the hump of her dorsum and the width of the tip of her nose. Here you can appreciate her results 1 year after her surgery. This patient underwent primary rhinoplasty. Her main concerns were the hump of her dorsum and the width of the tip of her nose. Here you can appreciate her 1 year after her surgery. This patient underwent primary rhinoplasty. Her main concerns were the hump of her dorsum and the width of the tip of her nose. Here you can appreciate her 1 year after her surgery. This patient underwent primary rhinoplasty. Her main concerns were the hump of her dorsum and the width of the tip of her nose. Here you can appreciate her results 1 year after her surgery. This patient underwent revision rhinoplasty. Her main concerns were the hump of her nose, secondary to a displaced graft, in addition to the width of the tip of her nose. She also wanted to improve the projection of her nose. Here you can appreciate her results 1 year after her surgery. This patient underwent primary rhinoplasty. Her main concerns were the hump of her dorsum and the width of the tip of her nose. Here you can appreciate her results 1 year after her surgery. This patient underwent primary rhinoplasty. Her main concerns were the hump of her dorsum and the width of the tip of her nose. Here you can appreciate her result 1 year after her surgery. I hope that this video was informative and that helped you understand better the details related to your procedure. If you have any further questions, please do not hesitate to contact us. I'm looking forward to participate on your transformation. Thank you again for considering us for your surgery.